We would now like to invite Dr. Zubair Tahir to address the participants regarding his journey.
Perfect. So thank you very much, Fatma and Faisal, for such a generous introduction, though I'm not used to it. Shahzad did a brilliant job, very comprehensive talk by him, and it is always a difficult act to follow. So few disclosures. I did my neurosurgery training from Karachi. So don't consider me as an expert for neurosurgery training in UK. Having worked in UK for last 8 years and being a clinical supervisor, I have mentored registrars and fellows from all over the world, and I have no hesitation to say that AKU neurosurgery program is one of the best. And Dr. Atar, Shahzad, and their colleagues are doing a brilliant job. So what my goal is in next few minutes, I'm going to dispel some myths around being a neurosurgeon, yeah, and give you an honest insight to what neurosurgery is all about. So as neurosurgeons, what we do, we assess, we diagnose, and we manage patients with neurological disorders, and that include brain and spine. I didn't have an illustrious career, so I don't need to dwell in it, but this is a timeline. I decided to pursue neurosurgery when I was in year 3 in medical school. And during my residency, later part of my residency, I decided to pursue pediatric neurosurgery. So for that purpose, I came to UK, did my fellowship, and later on accepted a consultant job in London. The only reason to put those photographs is just to show that neurosurgery can be stressful, and in this process you can lose your hair and as well as weight. So what we treat, there are a wide range of conditions, and the list is too long. Just to mention few: tumors related to brain, spine, skull, spinal column, trauma, degenerative conditions, cerebrovascular pathologies like aneurysms, AVMs, cavernomas, strokes, functional disorders, treatment for epilepsy, surgical management for pain and psychiatric disorders, surgical treatment for movement disorders, and last but not least, my subspecialty as a pediatric neurosurgeon, I tend to see children with congenital disorders like spinal dysraphism, cranial dysraphism, craniosynostosis, and so on and so forth. So what a typical day looks like for me, I try to come to the hospital a bit early so that I have half an hour to go through my emails and plan my day. Usually we start our morning huddle at 7:30. The on-call fellow or registrar goes through the cases in last 24 hours. We make plan for all our patients as a team, and then we go round. Afterwards, it depends what you are supposed to do on that day. Typically, I have got 3 operating lists in a week. I do 2 clinics, and there are few MDTs. Of course, one of my passion is teaching and training, which is incorporated into my job plan. And there are meetings and more meetings and more meetings. One thing which is interesting, as your career progress, instead of operating more, you end up attending these meetings. So it's better to get used to them initially in your career. Now let's talk about the best things about this job. By the nature of this job, you end up building long-term relationships with your colleagues, and that's the best part of it. You spend, in a way, more time with your peers and colleagues as compared to your family members. So I was very fortunate to be trained at AKU. On your right-hand side, this is a pediatric neurosurgery department at Great Ormond Street Hospital. There are 6 of us consultants. We have got 4 fellows, 2 registrars, and then we have got a bunch of nurse practitioners. In addition to clinical work, what I really enjoy is spending time with my registrars. That's what we call trainees in UK, and fellows. GOSH is quite fortunate. It attracts fellows across the globe. So we have fellows coming from states as well as from Europe and Asia. And the beauty of this mentorship, often I end up learning more from my trainees as compared to training them. And in a way, you don't need to be a consultant to train someone. So once you join a training program as a resident, you are a mentor and a teacher for house officer or an intern. And it will be a dishonor if I don't mention here Dr. Arshad and Shahzad's name, because I learned a lot from both of them during my training. And this mentorship is both in clinical and non-clinical setting. As Shahzad rightly pointed out, we traveled a lot. And that's one of the perks of being a neurosurgeon. You have to go and present your data and your research in international meetings. So you can see in 2009, we were together in a WFNS meeting. People came to us and asked whether we are twins. No, looking back at this picture, I can relate why we were asked that question. Next to it, myself and one of my pediatric neurosurgery colleague from Southampton with Jim Goodrich. Sadly, he lost his battle with COVID recently. He was world-renowned pediatric neurosurgeon from New York. So the best thing in my job is essentially making difference in the life of a child. And how about that if you make that difference between the child is born? This is a case from last week where we performed a fetal repair of myelomeningocele. On your top right, you can see the uterus is exposed and the obstetrician is just going to perform uterotomy. On the bottom right, here you can see the defect, a myelomeningocele. This is the spinal cord surrounded by a sac. And this practice is based on a randomized controlled trial known as MOMS trial, which has clearly showed that intrauterine repair of myelomeningocele leads to better outcome in terms of motor function as well as decreased dependency on a shunt. Out of all the surgical specialties, I have no hesitation to tell that neurosurgery is at cutting edge. Yeah, there is a lot of advancement both in medical and surgical terms. Here you can see one of my patients where we performed robotic assisted stereo EEG. So essentially the patient has got Lexel frame on her head and is attached to a neurosurgical robot. And the robotic arm acts as a tool holder, and then we place these depth electrodes based on our hypothesis where the seizures are coming from. And on your right hand, you can see multiple electrodes are in situ. And the role of robot essentially here is to define the trajectory electrodes accurately. Afterwards, these patients, we undergo recording of their seizures and EEG data. This girl went on to have a resection and she has been seizure free for last 1 year. Probably majority of are aware of this pair, conjoined twins from Pakistan, Safa and Marwa. I was very fortunate and privileged to look after them as a part of team, as a neurosurgeon, along with my colleagues. And we did 5 set of surgeries on them. And you can see they are successfully separated, but still very close to each other. One of the best things about this family that I ended up not only their neurosurgeon, but also an interpreter. So I built very close relationship with mom and their uncle, and sort of counseling them in Urdu, explaining to them what exactly is going through and what are our surgical plans. The other challenge was the financial constraints. So as you can imagine, that the treatment was very costly. So we had to pursue GOSH charity to fund their treatment at Great Ormond Street. And I have been involved with GOSH charity since I joined. And my way of supporting Gauche charity, I do long runs and generate money for Great Ormond Street. On your right side, the building you can see, this is Walkie-Talkie Tower in front of River Thames and London Bridge. Gauche organizes vertical running every year, and I did last year. It has got probably 38 or 40 stories. And to my pleasant surprise, when I reached on the top, who greeted me, it was one of my patients who was there to support me. And she's a beautiful young girl with optic pathway glioma, and she's currently under treatment at Gauche. So those were the perks, those were the good sides. Of course, becoming a neurosurgeon is never an easy job. And what are the challenges? So here you have got Cushing telling to his long-standing registrar when he said that I need to marry. And the Cushing response was, doing brain surgery requires putting one's affections on ice. Yeah. Fortunately, I didn't train with Cushing. And my supervisor, Dr. Athar Inam, was very cool about my decision to marry. But you need to understand there are no down days in neurosurgery. And when I say no, I mean no down days. This is me with my daughter, who is few minutes old. I still vividly remember I was on-call neurosurgery registrar while running between A&E, which is accident and emergency, and delivery suite. So I received head injury on calls in A&E. I went there and then went to a delivery room to make sure my better half is doing well. Ended up in theater during the night time. In the morning, got a bleep that Farheen requires emergency C-section. I had to wheel her all the way to the operation theater. It ended up really well. We are very fortunate to have Aliza with us now. But to be honest, nothing has changed since then. And one of the challenges pursuing neurosurgery is to sort out your work-life balance. It is a hard subspecialty. The days are long. It can get quite busy during your training as well as you become consultant. And the margin of error is quite low. So you can have difficult cases with outcomes which are less than favorable, and you end up with having really difficult conversations with families and your patients, and one has to bear that in mind. So if you ask me what are the skills required to become a good trainee or a good neurosurgeon, I can quickly summarize. One, you have to be closely attached to your goal. You have to be really compassionate, and you should have emotional strength to manage the hard work, but also pursue your goals. What I reckon, everyone who goes into neurosurgery will get a job. Okay, and majority of them will make careers out of it. Very few will get a calling, yeah, and only the lucky ones will follow their calling. And when I decided to pursue pediatric neurosurgery, again, this was not an option for me. I had to go for it, and this is the dedication you require. And the usual things, attention to the details, giving your best during your training, as Shahzad pointed out. You should bleed while you are in your surgery training. You should sweat hard. The other thing, you should be capable of running different teams, leadership qualities, communication skills, organizing yourself and your team. Don't worry, yeah, as a medical student, I totally understand that this is something we don't get an opportunity to learn, but during training, you will have plenty of opportunities and options to attend courses and seminars to polish up your existing leadership skills. Last but not least, technical skills. I must admit, I mean, this is something which we speak a lot about, but I will not keep that as a topmost requirement. And to support my argument, I will leave you with this saying of Harvey Cushing, what he thought about a brilliant surgeon according to him. Right, so quickly coming to neurosurgery training in UK, how it works in UK. So as soon as you finish from your medical school, you have to spend 2 years as a foundation doctor, which is essentially as an intern or a house officer. After finishing your foundation program, you apply for neurosurgery training program, which is a run-through training program, and there is a national selection. Last year, there were 200 applicants. 60 were shortlisted for interviews, and we had 15 spots for them. The training typically looks like you can see on your slide. The initial 3 years are core training with rotation in allied specialties like ICU care, neurology, ENT. From ST4, which is surgical training for year 4 to year 6, you do general neurosurgical training. And the last 2 years are primarily related to your research and fellowship. Once you have completed your 8 years of training, at the end you are awarded a certificate known as CCT, Certificate of Completion of Training, and it is GMC, the governing body, which awards you that CCT on basis of your logbook, your exams, and few mandatory courses. Is this the only way to come to UK? The answer is no. And this is the pathway which I chose. I didn't do PLAB, I didn't do MRCS. I was lucky enough, just because I was trained at AKU and my CV was reasonable and I performed relatively well in my interview, I ended up being sponsored by Royal College and the Trust. So you can come to UK and join any trust as a trust grade doctor, which is like a junior trainee, but you're not in the program, but still you can give exams. And second is coming here as a clinical fellow. And I am currently national lead for Neurosurgery International Surgical Training Program being offered by Royal College of Surgeons. There's a lot of information available on website. So I should better stop here and give way to very respectable Dr. Arshad, and I look forward to panel discussion. Thanks very much for your attention.
Thank you so much, Dr. Zubair. That was extremely enlightening, informative, and it was very good to see the personal side of living the life of a neurosurgeon, and also the philanthropic initiative that you're a part of with your hospital. Going to ask about the pathway of pursuing a neurosurgery in the UK. How difficult is it to get training jobs in the UK for IMGs, for immigrants, and for people, especially from Pakistan? And also, is it true that Brexit has increased the chances of immigrants to get training jobs in in the UK?
That's a really good question. So my answer is yes, the opportunities have ever so slightly increased because of Brexit. But the pathway is similar after your medical school, like you do board exams to go to States, you have to give PLAB exam. And there are few exemptions to PLAB. If you have already done MRCS exam, then you need an English language test and come to UK. And after PLAB, instead of doing 2 years of foundation training, you will end up doing just 1 year, and then you go for your training number. As I said, you are competing with local graduate, but that doesn't mean you have got less chances. There are certain criteria to be a successful in interview, which primarily include your qualifications, your research experience, and your attachments. So there are loads of international medical graduates who are working in United Kingdom as neurosurgical trainees.
Okay, thank you. So you also mentioned that from 200 candidates, 15 were selected. So is that the number for the entire UK, or only for said your particular hospital? And so then how are the Pakistanis or the immigrants prioritized, not prioritized? Is it just selection? How do we go about that?
I'm glad you asked that question. So it is slightly different than Pakistan and also US and Canada and Australia. As I mentioned, it's a national run-through program, and SAC, which is governing body, keeps a close eye. For them, every graduate should get a consultant job in UK. So there is a bit of bottleneck and high competition when it comes to a consultant job in UK. So they monitor and they offer, it's a demand and supply. The second part of your question, I don't think there is any bias whether you are IMG or your local UK graduate. It's still a fair society and a fair system, and the decisions are made on the basis of merit. So if you perform well after your foundation year in those interviews and OSCE stations, there is no reason why you can't get a job. But unfortunately, the total numbers of spot, they are small as compared to the rest of the world.
Okay, thank you so much, Dr. Zubair. So there's also the talk of UK MLA, and so that as well as PLAB. So could you let us know if there is any difference between the two?
Say that again, UK MLA.
Yes, so that has been coming up, and that is similar to US MLE. But so my question was, is that similar to PLAB, or would it be replacing PLAB? So has that been going around in your hospital as well?
There are Chinese whisper. I heard when I went to last meeting with GMC, they are coming up with a new system where the UK graduates will be supposed to do a similar exam like international medical graduates, pretty much similar to PLAB. Regardless what we call it, it's going to end up with a similar theme. You have to give an exam so that you are equivalent in terms of your medical knowledge, and afterwards spending 2 years as foundation doctor and then going for a run-through number.
Okay, thank you so much, Mr. Zubair. That was extremely informative. And I can say on behalf of all of us that it was very helpful. Now we move on to Dr. Arshad Ali. Thank you for being so patient with us. And now is your chance to speak. So over to you.